So our next speaker will be Mark Johnson. He's by profession, he is landscape architect, urban designer, and he founded his own practice in Denver and provide service to projects all sorts of scale, huge scale, mega scale, in the States, in Europe, in Asia, in Middle East, in China, in many, many places. So I hope by his sharing, he can tell us about through the design, how to promote the public health. Mark, please.
Thank you very much. I always enjoy following Tony because he creates such an impressive contextual understanding of the global issues that I'm going to talk about in the most specific possible way. As Dominic mentioned, I'm a landscape architect and urban designer. I've been practicing for about 40 years. And my practice has always been somehow intrigued. My passion has been about how we bring nature into the city. And 40 years ago when I was young, I was interested in that, I think, for naive reasons. Today, as you'll see, I'm interested in that for more specific reasons having to do with the social, physical, emotional, and health of communities. Now, I'm going to go quickly and methodically through some progression of theory, but then I'm going to go very rapidly through a string of projects so you can see the evolution of thought on the idea of the relationship of city design and health in the past 40 years or so. We tend to have a default kind of understanding and perception that nature and people are somehow different. Of course, that's not really true. As Tony was just saying about the Anthropocene, we are starting to overtake nature in certain ways, almost set in a battle, a systemic battle between the processes of nature and the processes of man. But if you look at the distinction between the animals in the food cycle on the left, you will see that they are in some kind of a revolving cycle of symbiotic contribution to the health of an entire system. Yet this little girl with the spoon is exploring her world and starting to create her own construct of what that world is. And that's what differentiates us from the rest of the systems, that we take action to change the systems through how we use our minds. And when it comes to the idea of city, we have something very interesting here. The conventional city was really a product, and Tony mentioned the Romans, a product of trying to create good sanitation, an orderly, rational pattern of settlement, and so we cleared nature away to create a city. Yet in the 19th century, here Frederick Law Olmsted created the concept in response to the industrialization of New York City, the development of air pollution and so on, the idea that nature was somehow a romantic antidote to the evils of the city. So you have a kind of flip-flop of what the city means and what nature means here. But in fact, what you have are two systems, each of which are incredibly complex. And what we've done is replaced one with another. And the correct answer is not this. So I'm interested in how we put these two ideas together instead of side by side, such as Olmsted do, but hand in glove. Now, the urbanization is probably the biggest threat to the planet today. Climate change may be the one that we're causing, but this is the one that we're actively creating with more than half of the people in the world living in poverty. And if you look down at the bottom, Afghanistan, 4.7% urbanization rate. I've been working in Afghanistan for the last 3 years, a fascinating place to visit, a fascinating place to work. This is what Kabul, Afghanistan actually looks like. In the year 2000, Kabul was 1.2 million people. Today it's 5.5 million people, most of whom are living in these informal settlements with no water, sewer, or power. People are walking everything up and down these hills every day to survive. And we're engaged not only in trying to fix these areas, but in trying to develop a more rational expansion of the city of Kabul to give a healthier, safer life to a large population. And I could talk for a long time about Afghanistan. Of course, when we think of the city, we somehow romantically think of this Bruegel painting, which is a much more symbiotic relationship of people and nature, where here you see the town well, a village probably surrounded by agriculture, divided into guilds, a differentiation of labor, and people are mingling in the town square. There's a bit of debauchery, but it's all about the relationship. This town is here because there's water. With the development of industry, we had a shift. We had pollution, the poverty gap beginning to open up well over 100 years ago, and many great writers talking about this problem. And as was just mentioned, Ebenezer Howard, an Englishman, created this, the Garden City. This is an idea that was about taking the evils of the city and isolating one thing from the next, because the notion in public health was that time was you had to separate the disease agent from the host. Right? So the pathogen and the host have to be separated, leading to a physical plan that dispersed people across the landscape and connected them together through technologies. So you see here in the outer circle the intermunicipal railway, the grand canals, a central city, and a rope of allotments surrounding the side. So these are villages connected by trains and canals to put people into a landscape because it was believed that it was healthier. Now look, there's some fun here. In the upper middle you see there were epileptic farms, large farms, reservoirs, the insane asylum, and on the lower left, my favorite, the home for inebriates. Now this is kind of humorous and of course was pure theory, but it was implemented very quickly by Olmsted in the United States, beginning in this suburb called Riverside, which looks somewhat innocuous and kind of could be in outer part of the city of London, I suppose, but here it's on the west side of Chicago. This is a very insidious diagram, this idea of the planned city. What it's based on is the idea that you would ride the train from the city of Chicago, where the air was poor and poverty was high, and you would live in a clean environment in nature. The train station is the red circle, the red line is the train, and the round circle is the commercial center. By plan, the apartments for the poorer people lined the train tracks, which of course were steam locomotives with bad air quality, noise, vibration, and the physical dangers of being run over. So the poorer people lined the train tracks, and the wealthy people got to live in the big lots out on the greensward. So that the idea was the wealthy people had the highest level of access to green and health, and the poorer people had the least. This was a planning paradigm that came from Howard in the 1870s. This is built by 1880. This was fully built out. This is really the mistake of modern planning. These ideas were developed further by Le Corbusier in La Ville Radieuse. And here you see in this slide what this kind of looks like. In fact, you can look out the window and see this in a poorer form right here. But this kind of thinking, the idea that cities could be entirely rational, is at the core of where we started to depart from the idea of a healthy city. It was all based in the idea that we had to fight pathogens, not in how we live well, but how we stay healthy by avoiding bugs. That led to this, the American suburb, proliferated around the world, which leads to this, which consumes land at a tremendous rate, leading to sprawl, which Tony was talking about, all of these consequent effects. And here, only 5 years old in Dubai, we're still repeating the same formula. Well, what you get at the end is this. This is Las Vegas from 73 to 2000, and I really don't have to talk much about, you don't have to be that smart to ask yourself, is this good or bad? Now, if you look at the relationship between a traditional city and a modern planned city, you find very quickly some important effects. So on the left, if you say that most European cities are a factor of 1, the sprawl is 5 times worse in terms of its output of carbon. If you look at the comparison of Detroit and Copenhagen, Detroit uses 10 times as much energy per capita as Copenhagen, mostly due to transportation. If you look at the ideas and theories of how we connect cities together, the little green line says for distances up to 0.7 of a kilometer, it's simply faster to walk. But our cities are not designed to provide for the green line or the gray line, the bicycle line, to work. Our cities are all designed around the red line. The consequence of this, and since we're in Hong Kong, you can all have a cheer for Hong Kong. Hong Kong has the lowest gasoline consumption per capita within this entire chart, with Houston, of course, being at the other extreme. So this is a direct outcome of city form. The United States Center for Disease Control says since 1990, life expectancy in the U.S. has increased by approximately 40 years. Only 7 of those can be attributed to improvements in disease care. Think about that. The other 33 have to do with environmental factors or lifestyle choices, which are tightly linked, because if you live in an environment where you can't make healthy choices, you're trapped. They've developed a set of principles. Increased physical activity is good. Reducing injuries, improving access to healthy food, improve access to clean air and water, decrease stress, strengthen social fabric, provide fair access to jobs, and minimize the impacts of climate change. So starting about 8 years ago, a group of us at Harvard University, where I teach, formed a group at the Harvard Center for the Environment called the Working Group on Sustainable Urbanism, and we decided to explore this whole idea of what could designers do to affect this question. Everything is in silos. We all know the problem with silos. And we said, no, in fact, what we should do is we have to change the paradigm to focus on the outcomes, to focus on people, and to balance actions with resources. We came up with a theoretical framework for how we would make a sustainable and healthy city, and said if we focus on people, we would focus on economy, equity, and environment. And then you can read these categories below. But we didn't stop there. We took each of those subcategories and tried to identify the different factors that affect, for example, I'll go here. In the lower right, you see the term justice under equity. Obviously, justice is part of equity. And if you're going to have justice, you have to have access to justice. It has to respect you. It has to respond to you. There has to be recourse, and there has to be restitution. Without all of those factors, you don't have justice. So what we're doing here, and here's environment, tried as a group, and this is a pan-Harvard group from each school at Harvard, trying to come up with an organizational framework to think about how we all fit together, to think about the design of cities. And then we took it to the city of Newark, a very tough city outside of New York City. We tried to apply this framework. I won't read all these statistics, but in 2008, before the recession, Newark had 13% unemployment. My favorite is the one on the upper right. 1,900 parolees come home to Newark every year. I don't think anyone would see this as a positive indicator. We realized that Newark had a cycle of disinvestment which we needed to trade for a cycle of success. The 3 top goals, we worked with the community of Newark through a series of meetings to come up with these. These are not academic ideas, these are community ideas. First, jobs. People wanted jobs. Second, healthy and safe neighborhoods. And third, they believed if they had jobs and healthy and safe neighborhoods, they would have what they referred to as a city of choice, because their indicator of a healthy place was if I have the ability to make and implement choices, I'm living in a better city. So we then reorganized those factors from the theoretical set. And if we could go into this in great detail, it's very interesting because their economy is so tough that part of their sustainability agenda is to increase their retail sales, to increase their industrial activity. Health rose up as the second most important factor to them, and here you can see a few of the factors they felt, and these are the citizens of Newark, and the idea of having choices. And what's interesting, even though it's probably not correct, the idea of green and healthy environment is just one of the pieces. And I use that example because if we think of the environment as the only factor, we're going to be wrong. And of course, what we did then is said that you need to have a framework that addresses all of these factors. This yellow line is somehow, how do you balance out all these actions and all these resources to optimize? So now a few thoughts on practice. I'm going to show you a rapid succession of projects. This is downtown Denver, where I live about half time. I split my time between Denver and New York City. You can see it was an empty train yard. We revitalized the river and built a park. rebuilt and developed habitats on 10.5 miles of this little river. We did urban connections to increase biking and walkability to connect neighborhoods together across trains, river, and rail and freeways. We built the park and a neighborhood started to emerge. We envisioned what that neighborhood would be, and today we are about 80% done building it, and all of that is in the last 13 years. So this was an idea, if we could do something green, it would somehow bring people into the city, a very fundamental, rudimentary idea. Then we took on the redevelopment of our closed international airport. This is about 2,000 hectares of land, so it's quite big. We based it in an idea of creating a system of nature to unify neighborhoods. This was a runway. We took the runway out and we restored a stream. This is how we handle our stormwater. So what you're looking at is all new neighborhood development. And then we articulated the idea of fibers of green running into every aspect of the neighborhood, developing neighborhoods at very small scale with very different kinds of housing and neighborhood types to bring different kinds of people together on the theory that a diversity of place, a diversity of the demographics was a more socially and physically healthy environment. It's still just an assertion, though. There's no proof, just an assertion. Now, this does happen to be the fastest, simply put, the most desirable community in the state of Colorado based on its rate of growth. We then went to Los Angeles, which has a river which looks like this. You've probably seen it in the movies. This river is extremely dangerous, has completely changed the aquifer of the Los Angeles basin, and in the upper stream reaches it looks like this. Without the detail, in a 5-year period, we developed a now fully approved and partially funded plan to transform the river, to hold the floods, but to make it green for recreation, for air quality, for water quality, for habitats. Here, at the biggest part of the river, we can make this transformation to bring these kind of experiences into the hardcore infrastructure of the city of LA. And even this, here you see how the river passes through the industrial piece of downtown to create a great park, which is now underway, so that people can have this experience in Los Angeles instead of the experience of a river isolated. In St. Louis, we're working at Washington University Medical Center. About 27,000 people work here every day, and that's just the clinicians, researchers, and staff. It's the fourth highest by dollar volume research institution in the United States. It's not the most beautiful or pleasant place you'll ever see. Dominated by cars, people disconnected from the environment, and a very confusing jumble of spaces. We did 125 interviews with all these different kinds of people, and with no question, these three factors of all types of people were what stood out: congestion, disorientation, and anxiety. So we were asked, how could we address these three factors? This is actually a data-driven study that I've been working on for 9 years right now, but we are starting to get very serious progress on addressing this problem. I'm just going to show you the concept. First, to identify where you enter this as a system. The orange are the transit stations. Then to create a central green place that gives a focus or a center of gravity. Then to, in theory, create an interconnected diagram, which in this level looks very simple. A series of green connections for orientation, for a sense of relief. Then to load the patient side, the visitor side from one end, and the staff and services side from the other end. And to then, we've now organized the logistics of all these buildings, about 8 million square feet of space, to create what we're starting to implement now, which is actually a very rich, articulated hierarchy of green spaces and connections, so that you're never more than a corridor away from an outdoor space that will take you to any other building. Also in St. Louis, and this is probably one of the toughest projects you'll ever see, we have taken on the redevelopment of the north side of St. Louis. This is the most disease-ridden, highest crime zip code in the United States. was built before the Civil War. It was torn down partially for freeways. It's the site of the famous Pruitt-Igoe housing project, which was opened in 1963 and imploded in 1973 after they sent in the National Guard because the crime levels were so high. I actually personally know several people who had family members shot in Pruitt-Igoe. We now own this site. My client owns this site. To show you how a city can go into decay in a post-industrial state, on the left you have 1903. On the right you have last year, the same blocks. This is the house that's left in that block. This is what it really looks like. We established a set of metrics here with only 5 categories. Today we've developed this to 9 different objectives for this neighborhood, each of which we are now supporting with a series of metrics. We have negotiated these metrics with the community and with the City Council of St. Louis, so the redevelopment plan actually includes these metrics, of which we now have 9 sets that will take neighborhoods like this and begun to do things like this. So here, metrics on a green framework. And we've come more and more to believe in the idea of fibrous pieces of green as opposed to big pieces of green. But now I'm about to contradict that statement in my newest project. We're working in New York City in a neighborhood called Mott Haven, Port Morris for Bette Midler. You probably know her as an actress and a singer. She started something called the New York Restoration Project. She's a very impressive woman. NYRP, as it's called, takes care of, fully manages 3 parks in northern Manhattan, owns and manages 52 community gardens in the poorest neighborhoods in the city, and by the end of this year we'll have planted 1 million trees in the city of New York. That's pretty impressive for an organization started by an actress. And she came to us about 4 years ago and said, we've succeeded with many built projects and many participants. What do we do next? And she said, the New York Restoration Project means more than green places. It means restoration of community and public health. How can NYRP make a systemic difference in the health of a very tough community in New York City? This is that community, Port Morris, Mott Haven in the South Bronx. Now, if you've heard of the South Bronx, this is the neighborhood that you're thinking of. This is the toughest neighborhood in the city. The goal is to design a project that is based in evidence and community objectives to implement and monitor the performance for many years. So we are specifically going to build a green intervention in the South Bronx based in health research and community objectives, and then we're going to monitor it. So we're building a research project. This is a collaboration of clinical care providers, public health researchers, geographers, designers, and the community. And here's our team. NYRP. The Montefiore Medical Center is the primary health care provider in the South Bronx. They have great data and wonderful people who've been working here over 100 years. We're the designers, that's me, Civitas. The Columbia University Mailman School of Public Health has been working with us in great detail to great success. The Columbia Spatial Information Design Lab has been helping us with mapping. There's a metrics evaluation and monitoring firm called Health Design that's going to do the actual organizing of the monitoring over the next 20 years. We have 2 community engagement firms, and then NYU's Environmental Health Clinic is working with us also because they collect the environmental quality data for us, whereas Montefiore has the patient data. This is where the neighborhood is, the little green square. You can see it's just above Manhattan. And here it is within a drawing that shows you the green areas within the city of New York. So you're looking there, that's the entire city. That big rectangle is Central Park. And then zooming in, you see the neighborhood we're working in with the red line. It has 1 park, and it's not a bad park, but it's not well developed. It's not that accessible. It has very few facilities. But look just below this neighborhood is something called Randall's Island, which is a huge park with massive recreation facilities, soccer fields, basketball, baseball, football, recreation centers. But just across the river is Mott Haven. So this is what our neighborhood actually looks like. You might remember the Le Corbusier drawing that I showed you earlier. This neighborhood has some challenges. As I said, we're going to implement a physical environment that will improve health, well-being, and safety, and monitor that for at least 20 years. The issues. Mott Haven ranks the worst for asthma rates in New York City. It has the highest mortality rate in the state, has the highest rates of vulnerable populations in the city, and the highest rates of heart attack and pedestrian injury. The rates of emergency room visits for cardiovascular events in Mott Haven are twice the average of the city of New York. The rates of emergency room events for children under 12 from accidents are 3 times the rates of New York City. So this neighborhood has some problems. 45% poverty, 71% obesity, 50% higher asthma rates. A third of the people are under 18. There's plenty of this, but it's still a very vocal, fairly well-organized community, very spirited, but it's an environment that's unhealthy and unfriendly, not accessible. This is what it looks like when you actually get to the East River. Much of it has no sidewalks, so if you want to walk to the river, this is your path. The edges are abandoned. Lots of things are abandoned. Even more things are abandoned. And we have run a series of community meetings that had a very rich set of inputs. We did tours of the neighborhood. The Bronx is a fascinating place. After my first community meeting, the next morning I got a call from Carmen Santiago. And Carmen said, "Oh, Mark, I have my whole floor organized." She lives in public housing. "Our whole floor is organized. We're going to take our phones and we're going to go out and take pictures for you. All 57 of us, we're going to go out and take pictures and we're going to show you all the problems." And they did. They sent me over 500 pictures a week later of all the things that they saw in their neighborhood that were good and bad. And this is just fantastic. The Columbia School of Public Health did a very detailed literature review for us, looking for all of the verifiable scientific papers that had found significant correlations between environmental factors and public health, and tried to interpret for us how those might be applied by us as designers to improve this community. The primary findings were insufficient physical activity, air pollution, and traffic risks were the 3 big things. But there's another thing that they found. They found a study that showed that there's a significant correlation between when community members participate in defining the project, the participation rates and benefits of the projects are significantly higher. Second, sidewalk improvements, walking paths, and enhanced connectivity may increase the likeliness of outdoor exercise. This neighborhood doesn't have sidewalks. Well, maybe sidewalks would make it easier for people to walk, and maybe people would walk more. There's one study that showed that where a New York City neighborhood had a tree canopy exceeding 50%, there was a 50% reduction in body mass index problems within that neighborhood. Traffic issues are fairly obvious. Pollution is fairly obvious, but one thing we were able to verify is that air pollution is better, air quality is better at the water. But the most important one was a study that found this. Parks that are 6 acres or larger in size have a demonstrated and significant benefit for asthma, diabetes, and body mass index. So if you live in New York City within a half mile of a park that's 6 acres or larger, you have a good shot at having a better performance under these 3 health factors. This study also, though, found not going to say there's no correlation, but this study could not identify a correlation between smaller parks, playgrounds, tot lots, community gardens, parklets. Could not find a health correlation. So what we said is this, in talking to Columbia, why is that? Why is a bigger park better? Because we can't buy 6 acres of land in the South Bronx. What we found with them, we came to what they like to call Mark Johnson's theory of change, which I'm very proud of, by the way, that they said, of course, the length of stay and the level of activity would certainly contribute to health in a larger park. I said, I think the factor is the motivation to go there is different. The motivation to go to Central Park is different than the motivation to go to the playground, where probably the kids are playing and the mom is munching, right? Probably the mom is eating while she's watching the kids play. And what she's eating probably isn't terribly good for her. And so it's a place for activity for kids and inactivity for parents. So we said these 3 things. If the motivation is what's important, let's make the parks on the water, because the water is probably the most motivational destination we have. Second, air quality is good there, and we know that's the #1 correlating problem after traffic safety. So let's get people there. And third, our theory is that if we create a linked series of parks, we can emulate that length of stay and level of activity by connecting place to place when we can't make one big place. So now I'm essentially done. This is a system. We took it to the community. We said, hey, give us your ideas about these places, and believe it or not, they did. This was really fun, by the way. So we zoomed in on this with the community's acceptance. We're working within this area to create this loop. And here we're just showing, okay, things you can do immediately to start to promote activity. You can use paint. You can add art and food and trees. And with more capital, you can make a much safer environment. Or here, this is actually how you walk to the waterfront in the South Bronx. You can use paint and art, and you can make a big difference. And of course, you can make it better with more capital. You can identify the place. And we thought this was really silly. The people in the Bronx, this is their favorite picture. Welcome to the Bronx. Because pride is a very important part of social health. And then, see, just bang through a couple more, you'll just get the idea. So this is a very rich and robust $50 million project to make a chain of parks like this, and then just too many slides, you get the idea. These are the metrics that have been developed by Columbia and Health by Design. And obviously, I have no intention of going into them, but we now have agreement between those 2 entities and Montefiore on the specific metrics they're going to track on the medium-term outcomes and health impacts that we hope to achieve through the project. This is where we are in the project. We announced the project last Wednesday. We've been all over the press in the New York Times. And this is where we had our project announcement. This is our first project site, to give you an idea of what we're trying to overcome. Thank you very much.